We're discussing current issues. We're coming at you fast with many, many issues that are just popping up on headlines. The one we're dealing with right now is basically hospital staff getting laid off. They're being put on leave if they haven't disclosed their vaccine status or if they themselves are refusing to get vaccinated. And this is happening across the country. Hannah is joining me, Hannah Salamon-Vegh. We've seen a couple hospitals, even in Ontario, Windsor Hospital, 140 unvaccinated staff placed on leave. Ottawa, more than 40 in our nation's capital. What are your thoughts on this?
Either we're living in a global pandemic or we're not. And if we are living in a global pandemic, when the whole goal and the whole rhetoric from so many politicians throughout this entire time is we have to, lock down, we have to social distance, we have to wear masks, we have to get the vaccine and everything like that in order to prevent the hospitals from being overwhelmed. And not only, the hospitals and the number of beds, but also the nurses, the doctors, the staff, that type of thing. So if the hospitals are truly at risk of being overwhelmed, then why would you fire all kinds of healthcare workers during this time? And I've heard the numbers being even more than that in some places, especially in Quebec. I know this is happening in the US a lot. So it's very heartbreaking. I have people personally in my family, people that I know who are going through this very difficult situation right now. So on a moral level, I think it's wrong, but also just on a public health perspective. If we actually are living in a pandemic and we don't want the hospitals to be overwhelmed, the first plan of action should be not firing the people that you need.
Yes, well, that's a good point. You mentioned the United States. Well, they have huge capacity. They have, private health care. We don't have that in Canada.
Right.
We control how many graduates come out of universities for medical school, nursing school, to kind of meet the demand of healthcare. Obviously, in this situation, we've had a huge surge for healthcare. So a good point, but some people would say, well, maybe those healthcare professionals are being selfish. Why not just get with the program, get the job? If you're going to be a frontline healthcare staff, why aren't you doing what you can to protect their patients? Some people would suggest that perspective. Is that wrong?
Well, so that's a very good question that you raise. And I would say, previously there have been some healthcare workers who have not wanted to get the yearly flu vaccine, and they've been able to pretty easily get an exemption. And some people say, well, aren't all the other vaccines that healthcare workers supposed to get mandatory? In most, situations they are. I would say with the new COVID vaccine, it is new. It has not gone through the same type of testing as any of the other vaccines. And normally it takes many years for a vaccine to come to market. So there's still a lot of questions. The trials have not gone through yet. There's also been, a number of adverse reactions. There's still not clarity around pregnant women and whether they should take the vaccine yet or not. So there are many reasons why some people are hesitant right now. And it doesn't mean they don't want it in the future, but they need to be able to be given time to figure out and look at more data, that type of thing. So anytime we force medicine through very quickly, it can have adverse reactions that we're not expected, not anticipated, that type of thing. So there are some people who are in healthcare who may take it in the future, but they just want a bit of time right now. And I think if we truly care for our healthcare workers, and there's been tremendous amount of appreciation for our healthcare workers.
Right.
Now, many of our heroes from yesterday and from last year are now going to be our unemployed. So I don't think it's a very loving thing to do after they've been serving on the front lines this whole time.
You bring up a good point. I've seen some of these visuals or these pictures of healthcare workers, either protesting or holding up a placard saying, I was essential when you needed me, and now, I worked all throughout COVID, and now I'm just being cast away. And it was jarring. It's a very good point. Are we simply casting away people when we don't need them? Or is there legitimacy here in the concerns of those in healthcare saying, hey, you know what, we need to have the top level healthcare provided, and that means everybody has to be a team player and be on board?
And also, I think we should, there should be pause for consideration and maybe some concern. If healthcare workers, in a certain percentage of them, don't want the vaccine, then maybe we should take them seriously. They are healthcare workers after all. They know what they're doing. And sometimes, I think they know way more than our politicians do. And unfortunately, the whole COVID situation has been so politicized that many doctors and nurses who actually know what's going on, they actually are there in the hospitals, they're there in the ICU units, they know what's going on, and they've not been allowed to say what's going on, ask questions, raise questions, that type of thing, because of the muzzles basically on them from the politicians.
Well, some front care health staff have been raising concerns, and we've seen a spate of protests outside hospital establishments. We only have about 30 seconds before commercial, but there's been some condemnation about these kind of protests. Don't protest outside a hospital, but these are the people who work inside the hospital. Maybe they ought to. It's like a picket line.
Yeah, so there's been so much misinformation about these protests. The protests have been for the healthcare workers, and there have been a ton of healthcare workers who have been protesting at them. And the protests are to raise awareness about them losing their jobs because they don't want the vaccine. So these protests are for the healthcare workers. And I mean, maybe we can talk about location. Maybe they should be somewhere else, but they've been in support of our healthcare workers who are losing their jobs right now.